I retired when I was around 60 years old, and I had some pre-existing conditions. One was I had my right hip replaced in the year 2000. My left hip had the same disease of vascular necrosis. I didn't want to have it replaced, but eventually I couldn't take the pain anymore. But I knew the procedure had changed, and I wanted better quality of life. So that's why I decided to have my left hip replaced. I had surgery here at the VA Medical Center May 7th of 2018. I remember waking up in the recovery room. I felt great, a lot better than what I did almost 20 years ago. And the first thing, there was a physical therapist there, and she said, "Do you think you could get up?" And I said, "Oh yes, I can get up." And I actually took the walker and walked around the recovery room. Of course, the physical therapist says, "That's it." Said she'd never seen anybody do that before, but she's probably just pulling my leg. After surgery, for the first couple of weeks, the physical therapist came to the house. 2 or 3 times a week. They'll give you a regimen of exercises and they watch you. Some are very simple, but when you've had a hip replacement, they don't seem quite so simple. They will, of course, take your blood pressure, your temperature, and they make sure that you're doing what you should be doing. But that's important because they will get you going. Now, in my case, I was walking up and down the street within a week. Still, that was just something I want to do on my part because I want to enjoy what I got left in life. Nobody really knows how many years you have left, but I'm hoping to get at least 20 more good years out of my body. Hopefully I can. Anytime that you have a joint replacement, whether it be a hip, a knee, a shoulder, an elbow, your part is making sure that you have no infection whatsoever in your body. You have to have a good attitude, and it's no fun to go on life having pain. I'm sure there's a lot of veterans out there who've never had a hip replacement or a knee replacement or a shoulder replacement, but if you want a better quality of life, by all means have it done. The technology is great today. After probably a couple of weeks, you won't be in any real serious pain. Well, I would give him an A+. I mean, the team was fantastic. The surgery went well. I had my own room, and I even talked to a floor manager. I was having the greatest treatment in the world. When I pushed that button, someone was there immediately. I mean, they would help me get to the bathroom, everything. I mean, there was never a delay. It was always a good, cheerful, friendly attitude. So I'd just give them a big 10. That was all I could say. I was just treated fantastic. I can tell you right now, from 2010 to the present, the attitude in the VA has changed greatly. And I'm very impressed with the VA today.